Hi. Hi. And welcome to episode 36 of Holistic Movement with me. And today's theme is no, not the vagina, is lower back pain. Why do I have lower back pain? Why, Rob? Tell me the answers. I want to know right now because I can't take it anymore. I'm in so much pain. I don't know what to do. I'm going to tell you one of, or two of the multiple reasons behind lower back pain. One of them is called sensory amnesia. In neurology, this is when your brain does not register that certain parts of your body are there. It doesn't know it exists. For example, your back. Because it's in the back of your body and we mainly look in front of us, we can't register that the back exists. That's one reason. Another reason is of what Eric Dalton, an amazing therapist, said: a weak butt equals a weak back. So, taking those two things into consideration, this is what we're going to do today. We're going to help the brain register that the lower back exists by a technique called differentiation. Differentiation is when the brain can register that these parts in your body are separate. For example, how we're able to move fingers separately. That is differentiation. Otherwise, when we move the index finger, all the other fingers will move with it. It's fairly easy in the hand because the hand has very small, intricate muscles to differentiate. The lower back has larger muscles, and it can be more difficult to move those muscles. But we're going to differentiate the pelvis and the two sides of the pelvis. So let's get into it. You know, when you were in school and you had to do group projects with others, maybe your friends or people in your class you didn't want to really be teamed up with, or at work you have a group project to do. And indubitably, one of those people or other people in the group are not going to want to put in their fair share. So, guess who has to take up the slack? Yes, we do. Now, relate that to the body. Let's say that the butt, the pelvis, does not have good mobility. And this is the case with a lot of people. And I don't like to generalize that much. I try my best not to. But generally speaking, men do not have as much mobility in the pelvis for multiple reasons, which I will not go into right now. But women do as well. People lose touch with their bodies because we're too cerebral and we can't feel our bodies. So, this first exercise is to help with mobility in the pelvis. So then one of the multiple reasons behind lower back pain will be taken away. So let's bring mobility into the pelvis. Your left leg is in a half swastika position, the Buddhist swastika, not the Nazi one. And our right foot is here out to the side in line with our right pelvis. I'm going to show you the right side of our pelvis. I'm going to show you from this angle. And then you can see from this camera as well, my butt cheek is about to pulsate forward. It's a very risque class. First, the vagina shirt, then me pulsating my pelvis forward. One side of it, folks. Okay? And so I don't know if you can see both hands behind me. Let me show you. There's one. I'll show you from this angle. Here's one. There's the other hand. Can you see those hands there? Just for support. Let's go back here. Doing the whole circuit here. And I'm going to place my right hand on my right butt cheek. That way my brain can register it, because remember, it has sensory amnesia. And so this will help tell the brain that my right butt cheek is pulsating, dare I say, thrusting forward. Hopefully, Mom, you're not watching this one. She's going to hate me first for the t-shirt and then this. I'm going to keep the outside of my left leg pushed into the floor. Then my right big toe and my right foot is pushing down as my right butt cheek pushes that way. And my pubic bone right here in the center, that's kind of my focal point. I'm lifting that pubic bone towards my left knee, and then my pubic bone goes away from my left knee. Now, I'm going to close my eyes. I'm going to feel my right glutes, and especially where my glute attaches to my hamstrings. And I brought this up in other videos, but your glute maximus goes over the butt cheek, descends over and down past the gluteal fold, it's said. And it interdigitates, you love that word? It dream weaves with the hammies. So we're not only turning on the butt here and the right side of the pelvis, but also the hamstrings. And I can feel this in my right knee as well, a little bit. Yep. And then if I pull my shirt up here, I'm involving my right lower back and my right psoas so as to bring my pelvis forward. Let's do a couple more. Okay, we're going to drop that right butt cheek. We're going to line our backs. And we're going to close our eyes and compare the right side of our bodies with our left side of the bodies. For me, I feel that right whole hip complex in my right leg and my right lower back. I feel it has more space, and my left leg just feels like it's there. What about you? Push your right foot into the floor, roll over to your left-hand side. Come on up, let's do the other side. So my right leg comes into a half swastika, and my left leg is parallel with my left hip. Okay, I'll show you from this angle. Left hand on my left butt cheek, and I'm going to push my left butt cheek up. Let me show you from behind here. Now, what are you noticing? Do you notice that this side it more easily moves? I'm having a more difficult time keeping my right outer thigh on the floor. That's because I have tight inner thighs in my right leg. Yes. I'm closing my eyes now, and I'm really activating my left butt cheek. And as I let my left butt cheek drop, I can feel the pull from my pubic bone, because the attachment site for all these inner thighs is the pubic bone and the ramus, the lower ridge of my pelvis. Ramus is a fancy word for ridge, the ridge of bones in certain parts of your body, especially the pelvis. Do you find this side more difficult or easier? Are you left butt cheeked or right butt cheeked? Let's do a couple more. And I can feel my right lower back being pulled a little bit more than my left one. That means I have some tightness, and I'm talking concentric tightness, meaning some compression in my right lower back as opposed to my left. More than anything, my desire to do these exercises for you and film all this is to help you feel more of your body and feel each part of your body. So then you can bring mobility into each part of your body. And then, pain be gone. 2 more. Okay, let's lie on our backs. Let's rest here. How does the left side feel now as compared to the right? Does it feel activated? Okay, let's slowly open our eyes. Let's bend our left knees, bring our right arm next to our right ear, roll on over to your right-hand side. You might notice a change of scenery, but there's no change in my love of vagina. So we're gonna come on up and we're gonna strengthen the shoulders. Now, last week I posted a video about how to strengthen the shoulders safely and with not so little attention and too much attention. Too much weight or too little. So I thought we'd combine those two with this movement. If you want to go into more depth about this exercise, please check my playlists on my channel and you'll see that video on my shoulder playlist. So we're going to start with our right hand. Now I'm going to place my right hand on the wall. My fingertips are separated, and you can place the hand up high or a little bit lower or level with your shoulder. Experiment with all three. I'm going to do it up high because the leverage is longer and I really like this rotationary movement to strengthen the shoulder. I'll show you a close-up of the foot. My right foot is going to pivot to the right and to the left on my heel. Do that a few times just to warm that up, and then you can feel your shoulder rotate here. My upper body is rotating with my shoulder and my lower body a little bit as well, my right leg at least. And then I'm going to slip my right hand underneath, and I'm going to jazz hands it. And then I'm going to bring my left foot behind and pivot to my left, and then open up here. Another jazz hands. And everyone knows, if you've been watching, that I will seek any opportunity to jazz hands. When I rotate to the left, my arm locks and is straight, and I open up the whole pecs here, and then I bend it when I come underneath here. Yeah. Do you feel the rotation throughout your whole shoulder there? And the shoulder blade and the collarbones and the rib cage and the pelvis? Yep. If this is too much for your shoulder, maybe lower the hand. Or just stop. Maybe this movement is not for you. Not every movement is designed for you, or maybe at this time it's not proper for you. Let's do one more. I love this movement. And finish with a jazz hand. Yeah. Okay, let's drop that right arm. Let's rest here for a second. With your eyes closed, do you feel the sensations in the right side of your shoulder girdle as compared to the left? If you don't, I've said it before, I'll say it again. You're dead to me. Let's place the left hand up here. Separate the fingertips as much as you can. I'm going to pivot on my left foot. I'm going to walk through with my right hand. And then I'm going to pivot to the right. Pivot to the left. Now you may notice a difference between this shoulder and the other one. Now, one thing that I didn't point out in the last arm, sorry about that, was this right arm can go low or high. Take it to different heights and see how that affects all the muscles in your rib cage and your shoulder and your arm and your wrist and the opposing, this arm, this right arm. When you go low, does it affect the right side of your rib cage differently than the left one? So all of these are experiments for you to try out and see which one helps your shoulder become stronger. Shoulders. Yep. Let's do a couple more. Yes. Let's lie down on our backs again. And then we're going to go back to the beach. Yep, going back to the beach. Finish at the beach. But let's lie down on our backs and feel your shoulders and your shoulder blades. My shoulder blades have a lot of area touching the floor here. I really like the spaciousness in my shoulder blades. What about you? Keep resting. Okay, let's bend our left knees, bring our right arm next to our right shoulder, roll over to our right hand side. Let's come on up. And I thought we'd get some mobility and lengthening into the front part of our body, especially the psoas and the hip flexors. That way it'll take away some pressure off the lower back. And we did this one a couple weeks ago, and I've been playing around with it, and I really love it a lot. And I'm going to bring my right leg behind me. And if your knees hurt, you can place a pillow underneath if you want. And I'm going to bring my left heel out. Let me show you from the front so you can see the alignment of my legs. They're a little bit wider than my hips, my skinny ass hips. And I'm going to flatten my right foot. If that hurts you, if you start to cramp, you can curl the toes under, of course. And my left knee is a little bit ahead of my left heel. Now I'm going to tighten my right butt cheek. Again, I'm touching it so then I can tell the brain that it's there. I'm going to try to bring my pelvis and let it sink as far forward as possible. That way I can lengthen all these hip flexors here. And when I lengthen these hip flexors, I can come into better posture because my psoas is not bringing me into flexion. Then I'm going to bring my arms up. Sorry, clear my throat here. And if it's okay if my arms go out of frame, I'm thinking, how can my rib cage come up and lengthen? And from my right fingertips and my left fingertips, I'm thinking a continuous line all the way down to my toes. Can I lengthen that whole line? In anatomy trained terminology, Tom calls this the superficial front line. And if you can visualize that, and you can lengthen the whole front part of your body, that brings you out of flexion, like I said. Yeah. So let's inhale up and then exhale down. Inhale up, keeping that right butt cheek tight. Exhale down. Inhale up, exhale down. Inhale up, exhale down. Inhale up, exhale down. Let's do one more. Inhale up, exhale down. I'm going to drop both hands down. I'm going to bring my left arm on the inside of my left thigh. I'm going to bring my pelvis back first. Then I'm going to come back and I'm going to kind of do this half squat here and feel the whole right side of my body. Then I'm going to turn to my right. I'm going to bring my left leg back. This whole left side. I'm going to bring my right knee ahead of my left heel. Tighten my left butt cheek. Let's bring the arms up. Lengthen. Closing my eyes. Feeling this whole left front side of my body lengthen and expand, create space. Inhale up. Exhale, come down. Inhale up. And can you keep your head in neutral? I noticed that I was bringing my head back and I was compressing the back of my neck. So I'm trying to keep my head in a neutral position here. Let's do a few more. Yeah. Drop both hands down. Let's bring the pelvis back first. And then bring the legs around. Let's lie on our backs. Let's rest here. and let your body just kind of sink into the floor. And then what do you notice about the front part of your body? Can you feel the front part of your body, especially your hip flexors, near your hip, your quads, maybe your abdominal region feels lengthened, maybe your chest. Okay, let's bend our left knees, bring our right arm next to our right ear, roll on over to your right hand side. And if you tuned in last week, you saw, hopefully you did the 5 Tibetans with me. I know that video was pretty long. I was explaining a lot. And I thought we'd recap one of the movements and not talk so much. We're going to do the camel cat. Let me show you from this angle. The reason why we're finishing with this as well is because it really helps strengthen the lower back. So we started the class with the mobility of the pelvis, right? And now we're moving up to just pure strengthening the lower back. And if you tune in next week, we'll go into more depths, and I talked about it earlier, with the pelvis and how to differentiate. And then we'll go into more back strengthening exercises. So tune in next week for the cliffhanger. Feet are flat. You can curl the toes under if you want. We're going to, again, this is a really couple feel class today. Place the palms on the butt, or if you got spider monkey arms like me, I'm dropping the hands even lower. So the starting position is here in neutral. Then I'm going to come forward into flexion. Just a quick review, okay, like this. Okay, this is exhale, and you're going to let the arms drop like you're stuck in a truck tire. And then I inhale back, come into extension, and then exhale, push that chest forward. And then inhale forward, stuck in a truck tire, and you're pushing that back up, trying to get out of the truck tire. And then inhale, come back. Exhale, push up. Inhale, come forward. Exhale, push that back up, tuck the chin under as much as you can. And then inhale, come back. And then exhale, push that chest up. What is that, 3? I think we're just going to do 11 of these, not 21 like we did last week. And then push up. Inhale, come up. Exhale, push that chest up. Open that chest up. And then inhale. And then exhale, push up, tuck that chin under as much as you can. And then inhale. Exhale, push up. Is that 5? Inhale. Exhale, push up. Inhale. Exhale, push up. That's 6. Inhale. Exhale, push that back up. Inhale. Exhale, push up. That's 7. Inhale. Exhale. Inhale. Exhale, push up. That's 8. Inhale. Exhale, push up. Inhale back. Use your quads in your butt. And then push up. That's 9. 2 more. Inhale. Exhale, push up. Inhale. Exhale, push up. That's 10. We got 1 more. Inhale. Exhale, tuck that chin under. Push the back of the neck up into that truck tire. And then inhale. Exhale, push up. That's 11. Let's lie on our backs. And we're all done. So let's let the body fall. And again, tune in next week for the exciting cliffhanger of how to differentiate the pelvis more and to strengthen that lower back. In the meantime, can you let your body fall and let go of all the tension that you just created and really inhabit your body and your breath to calm that racing monkey mind? See you next week.